According to a study by Medicare Health Plans, Montana ranks in the top 10 states for overworked physicians. MTN's Medeiros Babb tells us exactly where our state lands on that list.
There are around 2,200 physicians in Montana, caring for a little over 1 million people, ranking it as the 6th highest state in the nation in terms of overworked doctors.
The term kind of growing for this in the industry is burnout. Burnout of professionals, and growing evidence that impacts both patient experience and then actually risk to patients, and harm that can occur through the delivery of health care as well.
Montana has approximately 2.2 physicians for every 1,000 people. The national average is 2.8. Bozeman Health's interim medical chief officer, James Leffelholtz, says one of the areas doctors are really focusing their attention on is mental health. According to Medscape, around 300 to 400 physicians commit suicide each year, which is close to 1 a day.
Just as we ought to be more upfront and authentic about our conversation with mental health and decreasing the stigma attached around it for patients, we ought to be doing the same for our healthcare providers as well.
Another challenge for the Treasure State is its rural nature. Leffelholtz says often small towns are left without any medical care.
Imagine for the patients if you have to drive 4 or 6 hours in some parts of Montana to get to the dentist. And not everyone has the capability to do that, let alone in an emergency.
Leffelholtz says one of the ways Montana physicians are trying to solve this problem is through telemedicine. In Bozeman, Medeiros Babb, MTN News.
Thank you, Medeiros. The top 3 overworked states were Idaho, Wyoming, and Nevada.